TALOS AMI was an investigator-initiated, open-label, assessor-masked, multicentre, non-inferiority randomized trial which assessed unguided de-escalation from ticagrelor to clopidogrel in stabilized patients with acute myocardial infarction undergoing coronary intervention. Patients receiving aspirin and ticagrelor without major ischemic or bleeding events during the first month after index PCI were randomized to de-escalation to clopidogrel plus aspirin or ticagrelor plus aspirin. No loading dose of clopidogrel was used. Primary endpoint in the TALOS AMI trial was a composite of cardiovascular death, myocardial infarction, stroke, or bleeding type 2, 3, or 5 according to Bleeding Academic Research Consortium criteria from 1 to 12 months. There were 1,349 patients in the de-escalation group and 1,348 patients in the active control group. There was no difference in the composite of cardiovascular death, myocardial infarction, or stroke between the two groups at 12 months. But bleeding was less frequent in the de-escalation group with P is equal to 0.0012. Authors concluded that in stabilized patients with acute myocardial infarction after index PCI, unguided de-escalation to clopidogrel plus aspirin significantly reduced the risk of net clinical events up to 12 months, mainly by reducing bleeding events. Interestingly, there are some similarities between TALOS AMI and host exam trial, another trial which showed benefit with clopidogrel. Both were investigator-initiated open-label trials from the same geographic region and published in the same journal. While TALOS AMI showed an advantage over ticagrelor, host exam showed an advantage over aspirin. The rationale for the TALOS AMI trial was that ischemic complications were highest in the early phase while bleeding events occur predominantly in the maintenance phase. There was only limited data on de-escalation of dual antiplatelet therapy by switching from ticagrelor to clopidogrel in stabilized patients after index PCI after acute myocardial infarction. What we now need is a blinded study involving multiple geographical regions on the same aspect to establish the evidence on a firmer footing. First set of journal references. One more reference. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video. Kindly press the bell icon after that for getting all updates.